Hi, I'm Robbie. I'm an occupational therapist, and I've been working with your daughter, Cassie. Today, I just wanted to reach out to you and kind of let you know what I've been seeing and some of the scores that I've gathered from the assessments that I've been taking from her and describe to you what that means for her. So, first off, I just want to describe what I, as an occupational therapist, is doing with Cassie. I'm working with the teacher, and we're evaluating her on how she is learning in the classroom. So my goals are going to be more directed towards how I can help her enhance that learning within the classroom environment. This is different from other OTs that work in medical fields, like in a hospital. They'll be more focused on what the doctor has noticed, and maybe that might be a physical ailment that an occupational therapist can help with, maybe with strengthening or using adaptive equipment to better help them in that area. So just to clarify, I'm working with Cassie in an educational environment. So as an occupational therapist, I use assessments to help me better understand where Cassie is in the learning experience. And this just gives me a score, a number to be able to place to her abilities. So that score is what I call a raw score. The reason why we use assessments is because it's been done over and over again, meaning that there's been a lot of different raw scores that have been collected from different kids, and they have been able to compile those and see what would be considered typical at that age. So for Cassie, we were looking at her handwriting. So we wanted to gather that raw score and then see how it compared to the other kids. And to help better illustrate this, I like to draw pictures. So I just drew a picture of what I'm trying to describe. So if we have here in the middle, we would say if there were a bunch of kids that took this assessment, we would typically see if they were from 5 to 6 and they're doing this a writing assessment, they would fall around here in the middle if they're in typical development. But as we know, kids, they develop at different speeds. So some of them might be more advanced here on the plus side, and some of here might be just need a little more attention, and they'd be here on the minus side. These little marks, what we call our standard deviations, they just help us better understand how far away maybe a kid's development would be from normal, or how advanced they might be. So for this one, I just put where Cassie is right now. As you see that she's about one standard deviation, about a 1 or 2 away from the mean, meaning that she might need a little attention on some handwriting. And as you see, I don't have it as her raw score anymore, because once I'm comparing it to the other data, we now change it to a standard score, which a standard score can be now considered a z-score, just to be a little more confusing. So looking at Cassie's score, we don't want to keep describing it as, oh, she is 1.5 standard deviations away from typical development and handwriting skills. That might be really just unnecessary. So what you might have heard this when you went to the doctor, they put a percentile is what they say. If like your kid, especially when they're growing, for me, I have an example of my niece. Her head size was in the 95th percentile, meaning that it was clear up here in development, meaning that she had a big head. And so that just helps it. It's an easier way to describe these things. So with Cassie, if we calculated her percentile, she might be around, the 30 percentile in handwriting skills, which is okay, but it just means that she needs a little more attention in that area, is what I as an occupational therapist can do for her. So let's just sum this up. For Cassie, after the assessment, we've noticed that she's just a little below on her writing skills. Now, this necessarily doesn't mean that she's bad at writing. There could be other factors that go along with it, and that's what I'm going to continue to assess. But the term that we use is age equivalent. Because she's around 5 or 6, we typically see her being a little bit below. So I'm going to continue to work with her on those things and see if it maybe is a skill issue or maybe it's just an attention issue that she just doesn't really enjoy writing. But those are the things I'll be working on with your daughter.